At the multi-service center in Tillsonburg, we have the Tillsonburg District Memorial Hospital that we serve. In the hospital, they have the Flow Collaborative, and that has been really instrumental in our home at last referrals. All the CCAC case managers and discharge planners within our hospital, they meet with the staff every morning for bullet rounds with the nursing staff, the charge nurse, as well as the doctors. And they're marking on this whiteboard when people are ready to be discharged, who could come home on the home at last service. So that has increased our referrals using that as well. We are very fortunate in our hospital. We did receive funding for a transition case manager, and her role is to keep an eye on the ALC beds, to provide movement within those beds, whether it be to a long-term care facility, retirement home, or back into the community. But we do get a lot of referrals from her to move these clients out of those beds. Our program was implemented in both inpatient and ER in September of 2008. Our total number of referrals as of December 31st was 105, and 16 of those were emergency rooms. We've also been able to accommodate our day surgeries as well within the hospital. The South West CCAC, we have a co-development of South West CCAC referral form, and we also have a HAL portal that CCAC has created that has all our forms on it, so we can go in and access it. We have a chat room on there. We can ask questions to other HAL leads to see what they're doing and how we can make improvements to our program, but it also provides feedback to other agencies on what they can do with their programs as well. Mobilizing partnerships, we have assessment and case finding of HAL clients, and that's through the CCAC case managers and discharge planners. We're working with partners to evolve the program and assess needs, for example, expansion into day surgeries and emergency room departments. Enhancing relationships with partners to streamline a model of safe, effective, and timely discharges. So improving the service delivery, the HAL leads and coordinators, CCAC maintains communication and feedback regarding the clients admitted to the HAL program in an effort to continually improve service delivery, continuously building on strengths to achieve stronger linkages, for example, working collaboratively to achieve seamless service between geographies of Southwest and Southwest boundaries bordering HAL programs. So that's what a lot of our discussion is in our HAL network meetings, is how we can make this service a seamless delivery. Supporting and caring for caregivers, we have coordinated planning and provision of an array of services which lessens the burden on the family and ensures appropriate linkages to the support services. So when we do a HAL follow-up with the client next day, we're looking into not only the services they were receiving prior to the home at last service, but what services they might now be requiring to be maintained independently in their home, and so we're linking them with those people. Some of the challenges that the network group has found as we've been going along through the process is the initial inclusion criteria was 65 years of age and over, and it was initially required 24-hour advance notice of discharge, and it was too restrictive, and it was not well aligned with reality of hospital environment, because a lot of our discharges are same-day referrals. You get the doctor that comes in the morning, and they're saying the client's ready to go home that day. We've made some changes to that. We've lowered the age to 55, and we have all of our HAL leads are accepting same-day referrals from the hospital just to help to keep the bed flow moving. Our referral process was a bit of an issue at first. Quick turnaround time for same-day and ER discharges, that was a challenge. Consistent messaging and evolution of the program. The capacity of the HAL programs to serve hospital units and floors for the ER and day surgery, it's varied appropriately with capacity and implementation differences throughout the Southwest LHIN, because all of our programs are a little bit unique and a little bit different. Creating challenges regarding where the program is or isn't in the different Southwest areas as it continues to roll out, and that's where we're starting to collaborate together and share discharges so that patients are able to access the service. Delay in program funding, we weren't able to start until September 2008 for our implementation. Can't guarantee HAL hours or shifts, that's making staff recruitment and retention difficult, and we've had discussions around the table about that. Cost of ongoing marketing as well as education for CCAC and hospital staff That was complicating because of the vastness of their organizations and their staff turnover as well. So it's trying to keep all the staff in there educated. So we're in the hospitals quite a bit, re-educating the staff through lunch and learns and visiting the different floors and nursing staff. And also slow program growth and awareness, and that's being out in the community and trying to make people aware of the program and how it works. Our successes are the Tillsonburg District Hospital. We do have a transition case manager, and we are successfully doing our emergency room discharges. We all have the ability now to manage same-day referrals. We share discharges without having boundaries for each HAL area, which has worked out well. We all have experienced 100% client satisfaction, increased use of local CS services, and again, as Leslie had mentioned, the revised referral form. It was quite lengthy at first. We did pilot a few forms with CCAC, and the feedback from the case managers allowed us to bring that down to 2 pages. So what are our clients saying about the program? Some quotes are, "I love the health program. I didn't know how I would function at home or even get home safely by myself, which speaks volumes. The HAL attendant was like a ray of sunshine. She was so nice and helped me get home after knee surgery. It was a great help since my husband is also elderly and he didn't have to travel to London to pick this person up. The HAL attendant was very courteous and kind to order the meals on meals. So delicious, and how we're link those are the appropriate community support services. I was so pleased with the HAL program. The attendant was wonderful, and the visit was vital and wonderful. The program is an extremely valuable service. The attendant was great. It was so nice not to have to call and make arrangements themselves. A lot of them struggle with making arrangements when they're in the hospital. We do that for them through the HAL program, so that takes the pressure not only off the client, but also off the client's family as well, because a lot of them are working and are finding it difficult to get in there and help them. It was all done for me, and that was the best part. So we've had some great feedback from our clients on this program and how valuable